So just tell me like your name, and what setting you work in.
Okay, my name is Amy Everton, and I work in California Children's Services, which is pediatric outpatient for neuromuscular and orthopedic.
What brought you to this manual therapy course?
Because I didn't know enough about the actual anatomy to be able to identify it, and I needed better understanding of what was going on to address the kiddos with cerebral palsy, muscular dystrophy, and arthritis.
And you have a bunch of other cases too, like you have ortho cases as well. So tell me about some of those ortho cases.
So for us, the ortho cases are mostly just the JIA kiddos.
Okay.
So occasionally we'll have like a surgery to help with the wrist extension and opening the fingers. So they might do a web space release. They might do a carpal flexor slide.
For supination.
Yeah, flexor slide and all kinds of crazy stuff.
Okay, cool.
Then
So-
I got the brachial plexus kiddos.
You have brachial plexus kiddos too, right?
Yeah.
And those brachial plexus kids need surgery too. Like
Yes.
long run sometimes, right?
Yes.
So this is the other Amy that work in the same setting. So what did you like about this course, this manual therapy course?
I'm liking that I'm learning how to analyze from the distal all the way up to the shoulder, and that something that's in a shoulder can show as a problem in the hands or the fingers, and the other way around.
Cool. What about you, Amy?
I like having the framework because that gives me the steps I need to follow from evaluation to treatment. So that's really helpful.
What was one of your biggest takeaways from yesterday?
I liked how you simplified it for starting from yummy and then going to yucky.
Yeah.
Because especially for our kids, that's important. You want to start with something they're comfortable and like, and then switch to something a little bit more challenging.
What about you, Amy?
I liked the framework also, but I really liked being able to do the different treatments because I don't have that kind of information about how you isolate out the lumbricals.
You like the techniques, you like the
Yes.
manual techniques.
Yes.
Well, that's the whole point of this course, right?
Yes.
Awesome. So someone who's debating, oh, should I travel? Should I take this course? What would you tell them?
I would say definitely. Because even if you know the manual skills or you know the myofascial release, you don't have the framework.
What about you, Amy? Like, especially because everyone thinks like you have to be a certified hand therapist or want to be a certified hand therapist to kind of take this course. What would you tell them? Because you're not in a traditional outpatient setting, you know?
I'd say from anyone from a fresh OT grad to an experienced therapist would benefit from this program because of the framework and because of the way we're taught how to do all the manual therapies. It's very practical, something that we can actually do it the next week with our patients, and learning how to protect yourself from injuries because I have a problem with my thumb. It's like, oh, okay, that's really good because if you want to be in the career long term, you need to help protect yourself.
That's so great. Well, thank you so much.
You're welcome.